The following program is an original production of WICC PBS Chicago.
Tonight, more than 7 million people have signed up for the Affordable Care Act, including over 300,000 in Illinois. With the deadline behind us, what's next?
The mayor in the hot seat. His new pension plan will make homeowners and city workers dig deeper into their pockets, but will the unions go along?
And asleep at the switch, the blame game intensifies over the O'Hare Blue Line train crash. All of those stories and more on In the Loop. Today, we're joined by Naomi Lopez-Bauman, Director of Health Policy for the Illinois Policy Institute, and Peter Frost, reporter from the Chicago Tribune. Welcome to you both. We have to say we invited Deputy Governor Crystal Thomas or another representative from Get Covered Illinois to join us today, but they declined. Let's start with the big number here. 7.1 million people signed up for the Affordable Care Act, meeting the original goal. Now, I'm just wondering, is this a victory? Is it too early to call it that, Peter?
Well, I think it's too early to say. Of course, after the initial struggles with healthcare.gov, which rendered it useless basically for 2 months, it is a big number, and they're happy to get to 7 million. But what we don't know yet is how many of those people have actually purchased or paid for that plan. We also don't know the health of the people inside that plan, the age of the people. So it's too early to say, and I think it's going to be a different story in different regions of the country or even different regions of the state.
Let's dial down here in Illinois. We know that about 330,000 people signed up at last report. A majority of them, 200,000 or so, are Medicaid. The other 113,000 signed up for private insurance, which was the heart of this plan. Naomi, what are the implications for folks here?
Well, I think that first I'd like to say that the president's victory lap on the numbers was very premature. Whenever you take a look at who has actually paid for coverage and the people who were previously uninsured, you're looking at less than 2 million people likely nationally who were moved from the ranks of the uninsured to private coverage. Now, looking here in Illinois, you're going to see the same situation. We've got very few young people signing up, not enough to balance out the older and sicker. And what that is going to mean is much higher premiums as we go into 2015.
What about the number of people and the percentage? We have a majority of people on Medicaid as opposed to private insurance.
Well, yeah, at this point we have something like 220,000 people signed up for Medicaid. The state still hasn't processed nearly 200,000 applications, so this number could grow to maybe 350,000 people on Medicaid, which would be, far surpassing the state's original goal. They thought they were going to sign up 200,000 in the first year. So, it's going to be really interesting to see how this all plays out with this huge crush of Medicaid people, right away.
And what does that mean for patients and for doctors and for getting health care?
Right. The president promised accessible and affordable health insurance, and what they were promoting was the expansion of private health insurance, more options for consumers. But what we're seeing is a dramatic expansion of the Medicaid program. As we know here in Illinois, patients will wait for weeks and sometimes months, particularly when you're looking at specialists. So they're taxing an already burdened system that is a fiscal time bomb and that delivers inferior care compared to what you can get with private coverage.
Now, we saw millions of Americans lose their health insurance because the plans didn't fit the formulation of the Affordable Care Act. Peter, do we know how many of those people just bought different plans, or how many new people are actually coming to get insurance for the first time?
Well, we don't, again, until the final numbers are out, which should be sometime next week, we don't know, is the simple answer. But I think, the Tribune had a story not that long ago talking about 9 million new people, about 9.5 million new people into the ranks of the insured, whether that's through Medicaid or through these new private plans. So yes, some people did lose their coverage. In Illinois, they were allowed in most cases to keep that coverage. Blue Cross and Blue Shield, the largest insurer in the state, allowed people to renew their old plans. So I think in Illinois it's going to be a net gain and a significant net gain in the number of the insured, at least in the first year.
I don't think we're going to see a dramatic increase in the number of people moving from the ranks of the uninsured to the uninsured to the insured. Then the reason is that you've had so many cancellations in the individual market. There will be group market cancellations coming up this year in 2014, and because you're not really moving people you've got the people who are uninsured moving, who are not signing up for coverage. They're not paying for coverage. They're not actually going to be covered in these numbers. And the Medicaid population is also very fluid. And so whenever you take a deep dive into who are the newly insured, you're looking at an extremely low number. Nationally, you've probably moved fewer than 2 million out of the 48 million into the ranks of privately insured. And so the idea that what the president was promoting, accessible and affordable health care coverage, is not going to come to fruition, unfortunately.
Yeah, we've been, clearly some of the numbers aren't out, the final numbers aren't out, so there's a lot we don't know here. We don't know who has been previously insured. We're still waiting for a lot of these categories to coagulate. But there was a huge push to really get younger people on the rolls here. Illinois spent $33 million on ads in the Onion and other quirky ways to appeal to young people. Peter, do we have any idea how successful these ads were and how successful this marketing tool worked?
We don't know yet, and I feel bad because that's the answer I keep giving. But what Illinois did, well, I initially thought this was a mistake, is that they were not out there last summer raising awareness and doing education on this. They were to a certain extent, but they kept a lot of that marketing money back. And that turned out probably to be a pretty good idea because they didn't if they would have spent that money, they would have been sending people to a website that did not work. And so that money may have been wasted. So they did end up holding back a lot of that money, and they did hold it back for this last minute push in March. And I think what you saw just from the videos that you showed earlier, they had a ton of enrollment events at the last minute, and they were basing that on the experience in Massachusetts. Because as you know, Massachusetts rolled out sort of an expansion of healthcare back in 2006. And what happened there was you saw a ton of young people, the majority of young people signed up at the last minute. So, when you see the final federal numbers of 7 million, of course we don't know the final Illinois numbers, but there's a pretty good chance that a lot of those people are indeed young and healthy people based on the experience in Massachusetts.
Now, the government needed 40% of young people to sign up as a total aggregate of the plan in order to make this work to pay for older, sicker people. Do you think we're there? And what happens if we're not?
Well, look, a good product sells itself. No amount of glitzy ads or commercials are going to change that. The fact that the Affordable Care Act is a very bad fit for the young invincibles, those young people ages 18 to 34. We need 40% of those young people in the insurance pool in order to balance out the older and sicker individuals. They are not hitting that target. And whenever we take a look at the number of people who were previously uninsured who are paying for coverage, their numbers are very low. I don't think that we're going to get anywhere near the needed 40%.
What are the consequences?
The consequences, which we will be learning about in just about a month, is that health insurance premiums are going to skyrocket for 2015. Insurance analysts and people inside the industry are telling us that nationally we will see a 20 to 40% increase in premiums next year. Some markets around the country could see their premiums double. The next shoe is about to drop.
Oh my goodness. Well, there's a lot we don't know here, and there's a lot looking into the future we hope will clarify. Let's talk about the bigger effort here. Illinois got one of the biggest pieces of the pie in terms of $150 million to roll this program out, to advertise it, to get people involved in it. Yet the numbers here were significantly less than other states who got a lot less money. Peter, what went wrong here?
That's an interesting question. I tried to address that in one of my recent stories, but I think part of the issue here is some of the states that had higher enrollment in Illinois than Illinois through February at least did not expand Medicaid. Pennsylvania, Michigan, for example. Michigan's thinking about it. But, I guess a lot of people in Illinois were eligible for Medicaid. So people in these other states may have been, able to sign up for private plans just because they didn't have the availability of Medicaid. Now, in terms of why, I'm sort of confused by that as well. I don't know why Illinois doesn't have as many signups. One thing I did want to say about the premiums, however, is that is true. Insurance executives are out there saying, we could be seeing double-digit increases in premium prices, but I think it's going to be different. It's going to matter where you live and what part of the country you live. So in Chicago, for example, prices may go up 4%, and in Peoria they may go up 12 or 20%. I think it's too early to sort of make a blanket statement that it's going to go up 20 to 40%. I just don't think that's true.
Whenever you take a look at, for example, the Hispanic population here in the state of Illinois, they're predominantly young, and if they were previously uninsured, the products being offered under the Affordable Care Act are just not that attractive. They are subsidizing the older and sicker individuals, which makes their costs much higher. I think that's one of the very big reasons that you're not seeing bigger enrollment numbers in the state of Illinois.
Okay, Hispanics traditionally the most underserved when it comes to insurance. We'll have to leave it at that. Naomi Lopez Baumann, Peter Frost, Thank you for your time today.